Hi there, welcome back to this webinar on ADHD medications. I am Martina Carboni. I'm one of the consultant psychiatrists in the Three-Borough Adult ADHD Services, as some of you may already know. And I have with me today Alice. Alice.
I'm Alice. I'm one of the nurses and non-medical prescribers in the Three-Borough team.
Thank you. Some of you may have already listened to the part one of this webinar, which was on the rationale behind the decision of taking or not taking ADHD medications. And now we would like to talk about which medications to try. And the information that I think I am sharing now can be accessed through the link that you will hopefully will be sent on the ADHD pharmacotherapy in our service. So you can access this information through links that we should have already shared or we will be sharing with you soon. So let's go through the medication options that we have available and that are currently indicated for ADHD and licensed for adult ADHD or suggested by the NICE guidelines. So I'd like you to just take some time to consider options and their pros and their cons. To summarize the medications that we have available for ADHD, I would just start by um, defining what a stimulant medication and non-stimulant medication are. Both stimulants and non-stimulants do something very refined in our brain. They inhibit the reuptake of catecholamines, like, for example, dopamine or noradrenaline in the neurons that have released these neurohormones. In some cases, some medications, like for example amphetamines, are also able to actively induce a release of dopamine from the vesicles in the neuron and release this extra dopamine in the synaptic cleft, which is that microscopic space between the synapses, so between the ends of the neurons, in which all the incredibly enticing chemical and electrical signals pass from a neuron to another, and so the information gets transmitted throughout the brain and then becomes awareness. So all medications for ADHD, in a way or in another, modulate catecholamines networks. By catecholamines, I mean in specific dopamine and norepinephrine. The end result of increase in concentration of dopamine and norepinephrine in the synaptic cleft is typically seen from a behavioral point of view in an improved ability to focus and sustain tasks, attention on tasks, and an improved executive functioning, meaning improved ability to plan and to organize things efficiently. Improved, not perfect. These medications do typically help with this. Stimulant medications in particular are designed to stimulate the activity of the brain with sympathomimetic effects that are not just in the brain but also in the body. And this is why we have to monitor the titration, so the use of these medications regularly, also for the potential effects that they have not only in the brain but in the body. And in specific, Alice will be able to talk a bit more about the monitoring requirements for ADHD medications. But for you to know, you should be already aware of the fact that all ADHD medications will have to be monitored for any changes in the blood pressure or heart rate that they may cause, uncommonly, but they may cause. Some medications also can reduce commonly the appetite, so you would have to be checked also for your weight, just to make sure that you're not losing weight too quickly because of the suppressed appetite. There is a common side effect. Examples of stimulant substances that are not ADHD medications are nicotine, caffeine, that many of us, and definitely an Italian like me, are very aware of. And on me, caffeine works pretty well in improving my focus. But also substances, molecules that are in, for example, other medications like asthma inhalers are defined pharmacologically as stimulants, and also cocaine or amphetamines and methamphetamines. So recreational drugs can be described as stimulants. So given the potential effects that these medications can have on the body, we suggest typically to make sure that you're taking them responsibly, not mixing them with other stimulant medications, which could provide cumulative risks of side effects or interactions. So nice guidelines for stimulant medications indicated for ADHD include three medications or three molecules: methylphenidate, dexamphetamine, and lisdexamfetamine. Again, you will have a more in-depth conversation about your treatment with your prescriber. So don't worry about the details of these medications. We do know that methylphenidate and lisdexamfetamine work very well, typically, not all the times, but in most occasions. And we definitely prefer using trialing modified release preparation, meaning medications that can stay in the blood for 8 to 12 hours typically. The reason being that they appear to induce less risks when it comes to tolerance and addiction. And this takes me to a question that we have been asked frequently over the years. Are stimulants addictive, given that they share some pharmacological aspects of the mechanism of action with the recreational drugs? So stimulants are theoretically able to induce addiction, but we don't have sufficient data to confirm that this is a relevant risk for everybody trying stimulants. There is a risk of stimulant misuse and diversion, particularly with the immediate release preparations. So with preparations that once taken stay in the blood for just a few hours, and so that have to be medications that have to be taken more than once in a day. So we tend to avoid these immediate release preparations as much as possible to reduce the risks, and stick to modified release preparations. So extended release, prolonged release preparations. In our experience, but Alice, correct me if you have a different experience. In my experience, I didn't see people developing physiological addiction to ADHD medications. But what I saw through the years is that people who don't really invest on non-pharmacological strategies become reliant on medication, whereby if for any reason, and unfortunately recently we have been having a lot of issues with medication shortages in the pharmacies. So it's not easy in these recent periods in the UK to maintain continuity with medication. So if for any reasons medication had to be discontinued or changed in the dose, people who uniquely rely on medication may really struggle to adapt. So the suggestion is try medication, be optimistic about what it can do for your life, but never forget, use medication to consolidate other strategies over the long term, so you can hopefully in the future not take medication lifelong. This discussion is very, I think, is very important. So it's something that we would always suggest people really take their time to think and to share with families, with their caregivers, with their partners, with their children, because the implications of taking medication for ADHD can be profound, and hopefully positive in terms of changes in life, but not all the time. Non-stimulant medications. So I use the plural here, non-stimulants medications for ADHD, but to be honest with you, currently we have only one medication that is indicated for ADHD because it has passed controls, and we have sufficient scientific research confirming its efficacy to in controlling ADHD symptoms. And these non-stimulant medication is atomoxetine. Atomoxetine and other off-label non-stimulants, so stimulants that are not indicated for ADHD because we don't have enough research that would confirm their efficacy, but that in very rare cases we may consider. So non-stimulant medications in general work differently from stimulants, and in specific non-stimulants like atomoxetine can take a while in providing a benefit, while stimulants can provide a benefit pretty quickly. The changes in the ability to focus on tasks can be almost on the spot. You take medication and after a few hours you may actually realize that things change. Atomoxetine may require a bit of time to see the difference, to evoke the benefit. But if you ever were suggested trying atomoxetine, there are very good reasons behind this. And be confident, because atomoxetine can really work wonders with certain people. You have to be patient. You have to take it and be confident that only in a few days to weeks you will see differences in terms of, improved focus, for example, on tasks, or reduced side effects. Sorry, reduced restlessness, which is so frequently associated with the with the impairment of ADHD. Again, I will not talk about too much about other non-stimulant medications because they are currently not indicated. They may or may not be efficacious. We don't yet know about it. But I included just a couple of bits and bobs of information about it that I hope you will find interesting if you ever had the time to review these slides. Thank you for your attention. And I would ask if Alice has any comments or things to add to my ramble. Anything relevant that I may have forgot that people may find it useful to know about medications to take?
Thank you for that, Martina. I think one of the things that I will often discuss with patients in initial appointments is that medication options for ADHD are limited. So as you've discussed, there's kind of two broad categories. We have one non-stimulant medication that's recommended and two types of stimulant medication that are recommended. So there aren't a lot of options out there that are recommended in the UK. And some people, unfortunately, will find that either they have side effects on the medications that mean they don't want to take them, or they may find that actually they don't like the feeling of being on ADHD medication. So in the previous webinar you may have attended with Zoe, where she talked a bit more about generally what ADHD is, she will have covered some of the strengths of ADHD and the positives of having ADHD. And sometimes when people start ADHD medication, they don't like the feeling of being on it because they feel that some of those strengths or those positives of the condition can change. So it may be that you start the process of being on medication and make a decision for you that you don't want to continue taking it. And for some people, it makes a huge change to their life, and the benefits of it outweigh kind of any negative effects or side effects.
Right.
So that's all I wanted to add.
Thank you very much. And I just wanted to reiterate, don't worry about if there is anybody listening to me right now, other than Alice, don't worry about these type of discussions, because you will have the opportunity to talk about these with your prescriber. And I hope that you had just a brief introduction, at least, to ADHD treatment options with the clinician, potentially me, myself, who has confirmed the diagnosis or reviewed you for ADHD. All right, I would now pass to the next main topic that we wanted to discuss in these webinar sessions. And the next topic that I would like to review with Alice and you listening to us is about the logistics of medications, how to access them. And I hope that you are interested in that webinar, that you will find in the links that we will provide to you. And the webinar that I will be talking about soon is the logistics about ADHD medication. Thank you for your listening.